Allison Wells. I'm the clinical director here at Caprock. Caprock Cath Lab is the first and only outpatient cath lab in Lubbock. That's what makes us so unique. We're not like the hospital, we're more like a clinic. The patients come in, they're not here for very long. Usually the average turnaround time is about 4 hours. Sometimes a little bit longer, sometimes a little bit shorter, but it makes it very convenient for the patient. They can come here, get their lab work, their procedure, and they finish everything here. They're out in 4 hours and they're back to their home. What makes this place great is the people that I work with. They're all very educated. They're probably the best in town in my opinion, and they're very friendly. They focus everything about the patient. We want the patient to leave feeling like they had the best care possible. We strive for that.
My name's Heather. I do all the surgery scheduling for Dr. Curdy and Dr. Bradley. Once Dr. Curdy and Dr. Bradley decide you need a procedure done, I will call you and get that set up with you. We'll pick a day that's good for you and convenient for you, and we'll get you scheduled for that procedure at whatever facility that Dr. Bradley or Dr. Curdy decide you need to go to.
My name is Stephanie. I am the pre-op nurse at Caprock Cath Lab. So when a patient is scheduled to come in, what we're going to do is call them the day before and we'll talk to the patient and the family. We'll go over pre-op instructions. We'll answer any questions that they have with the patient or the family members before they come in. We tell them what to expect when they arrive. We tell them what to expect when they go home. That way they're prepared before they come in. When the patients come in, they get registered at the front. Once they're registered, they come back to me. I'll bring them back to the room. The first thing that I do is I'm going to explain the procedure to the patient, make sure that they understand what they're here for and what we're doing for them, answer any questions that they have about the procedure, any questions that they have about after the procedure. After we go over procedure, answer any questions, I'll go over their health history with them. I'll check their vitals. We'll do an EKG on them and start their IV. We'll pre-medicate them and prep them for their procedure.
My name is Carrie Rainbow. I'm a registered nurse circulator in the Caprock Cath Lab. Also watch monitors on occasion. When I go into the room and get the patient, first thing I do is introduce myself and ask them what we're going to be doing. And then I verify their identity with their ID band and also check their allergies. And then check the circulation in the wrists and the feet. I verify the permit and make sure there's a current H&P on the chart, and then the labs. Any abnormal labs I report to the doctor once he comes to the case. Once the vitals verified in the medical record and the patient identification, etc., then we go to the cath lab. They're assisted over onto our table if need be, or oftentimes they transfer themselves. And we hook them up to the monitors for the oxygen saturation, the EKG, and the blood pressure. The primary responsibilities of the monitor tech are to watch the vital signs, which are taken every 5 minutes, the blood pressure, it's continuous reading of the EKG and the oxygen saturation, and also documenting the procedure from start to finish in chronological order as far as what is done and with what equipment, as far as interventions or just diagnostic, and delineating that into a report for the doctor's reference afterwards and for record keeping as well.
My name is Shaylin Graves. I'm a nurse and I'm one of the recovery nurses after the cases that we have with patients. I get our patients from Carrie, who's our registered nurse in the cath lab, and we do a little shift report at the bedside and just go over what's happened in the procedure. My job is to make sure that the patient is safe and that they're recovering well. We check on them every 15 minutes initially. If needed more, then we'll do that. We check their vital signs, check their groin site where they've accessed the vein or the artery during the procedure. From that point, then we just go about 15 to 30 minutes, making sure patient's good, vitals are good, no signs of bleeding. Make sure they're comfortable, their pain's under control. Once we've got through the 2 hours, usually is our maximum time frame for them to recover. Some occasions we have them stay for 3. If they're a coronary case, it seems like we have them stay for 3 just to make sure everything's good. From that point, then we just make sure they can walk and ambulate and there's no signs of bleeding and that they're feeling okay, feel safe enough to go home, and then we discharge them.